Thank you. I'm following the master of messaging here, so I have a hard act to follow. Just what did the doctor order? What about those media messages you see on entertainment television? Your favorite TV shows, Grey's Anatomy, Law and Order, your favorite movies that have come out recently. I just saw The Fighter on a transatlantic flight, and The Fighter was depicting, all these shows depict various health disorders such as bipolar disorder, such as various addictions. Our physicians and healthcare providers are talking to us in all this techno talk, and all these health messages are being exchanged along what we call the continuum of communication, from the interpersonal side, which would be sort of dyadic interaction, patient-provider interaction, right? Where a physician may be breaking bad news of, let's say, a cancer diagnosis. What do you do with that information? The emotion creeps up. Your cognitions can't really function anymore, right, when you hear the C word. Add a family member to that interaction. We go down the continuum to a small group kind of interaction. Add another healthcare provider. Add more healthcare providers. We go down the continuum to the messages that are exchanged with healthcare organizations. Then get the insurance companies involved, right? So now we're getting a lot of mixed messages. What does the patient do with all this misinformation and often miscommunication? And a lot of it's accurate, but people tend to disagree, and it is really tough in terms of decision making that impacts our health. Then we'll go to the other end of the continuum, media messages. Again, watching your favorite shows and seeing depictions of things like bipolar disorder, schizophrenia, stuttering, various alcohol addictions, crystal meth addictions, like in The Fighter. To what extent are these media messages accurate? From the message we get on the dyadic side from our providers to the other side of the continuum, our media messages. Are these things that we've thought about before? Have you ever thought about the things you see on entertainment television and how those messages are being depicted? Are they being depicted in accurate ways, in ways that are accessible, that you can understand? Of course, they have to be compelling, which is what the entertainment industry does pretty well. And sometimes they fall short on the other two categories. Whereas physicians tend to do pretty well, and healthcare providers tend to do pretty well on the accuracy for the most part. Not so great on the accessibility part, and often not so great on the compelling part, although they're getting much better, and they want to get better. Did you all know that 80% of medical errors are due to communication breakdown? This comes to us from the Joint Commission of the American Medical Association in the early 2000s, and it's called the JCAHO, and the site was 2002. 80% of medical errors are due to communication breakdown. The bottom line is health messages matter, and there are lots of barriers to the health messages that are out there that we see from all the health information that we get from our providers, from our insurance companies, from our entertainment media sources, news media sources, social media sources, and so forth. There are lots of barriers. So I want to get you to think a little bit about the barriers in your own life. To what extent do you have barriers in terms of your own cognitions, your own ways of thinking about messages? What kind of barriers do you have emotionally, or what affective barriers do you have? Does the emotion get in your way where then you can't process things cognitively? What about behaviorally? Do you have some behavioral barriers that are getting in the way of the way you process health information? So health message barriers can lead to problems. It can lead to problems with our health in general, and particularly decision-making about our health. So in a weird way, health messages can actually play a role in extending our lives or not, which I never would have dreamed when I first started studying communication and health messaging 15 years ago. So it's a very exciting field to be in, and now it's the largest area of the field, this notion of health messaging, and so I've been really excited to be a part of that. The next thing I want to talk about is we have all this access to health information. Okay, so you hear the word cancer, for example. You do a Google search. All of this information pops up. We have access to all the information, things that people have been talking about all day today. To what extent are we sort of over-consuming? We have knowledge, we have lots of knowledge, we have access to lots of knowledge, but are we really critically analyzing that knowledge? Are we looking at the evidence base behind that knowledge? When we see something depicted on TV, and we see someone detoxing, for example, on a show, like The Fighter, right? Are we thinking, wow, is that really what happens when people are detoxing, right? Do we go then to the literature and see? Do we talk with psychiatrists and psychologists, many of whom are here today, about the symptoms and how that carried out? Do we question the way things are depicted? Or do we have sort of a lack of analysis or a lack of innovation? Are we bringing those borders within ourselves in terms of our thinking, our emotion, and our behavior and how we're looking at it? So I would argue that our mindless consumption, or our overconsumption, right, with social media, in fact, there are people addicted to social media too, and a lot of this audience could be in that category. I don't know. You guys tend to be an overeducated audience. So our overconsumption plus our sort of lack of analysis or lack of critical analysis of really important health information equals barriers and borders that we impose on ourselves a lot of times. So I ask you a question. Are you an innovator in terms of information and your critical analysis of health information and its connection to the evidence-based? Are we hearing evidence-based messages? That's the question we need to be asking. Well, it turns out that not only at-risk populations have problems interpreting statistics, words, and health information, but even educated folks like all of us have problems because we're not critically interpreting, particularly numbers. And I know some folks today have talked about issues of statistical illiteracy and numeracy and different ways of understanding numerical information. And we're finding a connection. Just because someone's educated doesn't really mean that they're able to understand numerical information. And yet, we're in a culture that presents a lot of its information in statistics. But conditional probabilities are kind of difficult for us to compute and understand. Whereas information, when it's presented as relative frequencies, tends to be a lot easier to absorb and understand. Just knowing that one simple thing in terms of the evidence base and the connection to the literature. For those of you who do strategically craft messages, right, that gives you an extra tool to put in your back pocket where you can help people to understand that information better. So are you an innovator, or are you an animal, where we're just being fed that information, we're just taking it in sort of passively? Hopefully you're an innovator. I'm sure you are, you wouldn't be here. Another question I want to ask you is connected to the literature on message framing, which will be the last thought that I'll talk about today, which is a body of literature that I just really love, and look forward to continuing to test messages in terms of how messages are framed, because the way that messages are framed impacts the way that we decode those messages. Berlow in 1960 came up with what's called the Smcr model. Have any of y'all heard of that? A few of you? A couple of you? One of you? Okay. So I'll educate the rest of you on it. It deals with the source, the message, the channel, and the receiver, the Smcr model. So it turns out the source of the message, let's say doctor, for example, physician, encodes the message, right, and sends it through a channel to the patient who decodes the message. And of course, the encoder and the decoder bring all of their cultural, social, political beliefs and health beliefs to that interaction, right? And so they're mutually influencing each other. But particularly, the source is influencing in terms of encoding the message and creating and crafting the message so that the receiver can decode the message. Think of a media example. The media, whether it's the news media or entertainment media, again, the encoder of the message sends it through a channel, and then we as consumers decode that message. How are we doing that? Are we critically doing that? In terms of message framing, messages can be framed. It turns out that factually equivalent messages can be framed in different ways, and that yields predictably different choices that we will make, particularly when it comes to decisions under risk. And it stems from Tversky and Kahneman's 1981 research on prospect theory, which is basically a descriptive model of decision-making under risk. So this is really interesting, I think, and it touches upon, are you a risk avoider or a risk lover? Turns out that when messages are framed as what we call a gain frame, we tend to prefer certainty when making a decision. Whereas when messages are framed as a loss frame, or a loss-framed message, we tend to be risk averse. I mean, we tend to love risk, or not love risk necessarily, but we tend to be okay with more uncertain conditions. So I have a visual example here. Although message framing can play out with numbers, it can play out with words, but I'm giving you an example visually because this is sort of a visual type of talk here. So here we have two different messages with factually equivalent information. The factually equivalent information is that this is a smoking cessation campaign, trying to get people to quit smoking, for example. All right, so you could probably guess by now which one is the loss frame message and which one is the gain frame message. Gain frame tends to be more of a positively framed message, whereas loss frame tends to be more of a negatively framed message, or what we call a fear appeal message. Okay, now you know. If you didn't know before, you know now. The one with smoking causes fatal lung cancer, and that visual depiction of a lung, of a smoker, is sort of a fear appeal tactic. Okay, so that's where people who prefer uncertainty or who are okay with uncertainty would prefer that message. The other message is saying, hey, if you stop smoking, you're going to get 31% of your taste buds back. You're going to actually be able to taste this apple. So there are different ways of presenting health information when the facts are exactly the same. And there are a number of other examples that I could give you, but as you all know, I don't have time today to do that. The point here is that message framing really matters. It matters in terms of the ways that we interpret very critical health information that can impact our lives, impact the lives of our friends and family members, because hopefully none of you have had to deal with cancer, but in some way, I'm sure you have. Most of the people I talk to have dealt with cancer in terms, if it's not for themselves, it's for a family member or a friend or a neighbor. Almost all of us know someone who's been touched by cancer. And I use the cancer example quite a bit because most of my research is in the cancer and messaging and cancer area. So message framing really matters. It can make a huge difference in the way that we interpret health information and make decisions, let's say, about our treatment when it comes to something as tragic as cancer. So remember this, statistics are complicated, okay? Words can be complicated and confusing. And it's so important that we understand that our affect can impact our cognitions. That's another sort of barrier that can get in the way of our critical interpretation and understanding of health information. There was a 2006 health literacy barriers to communication report that stated that we have difficulty obtaining information, processing information, and we have a real problem with ineffective communication strategies. So health information, message framing is so important to our lives. I'm encouraging you to move beyond the borders in your life, move beyond your lack of analysis of critical health information that could actually extend the life of you or a family member. Be innovators. Thank you.